We will begin with Joanna, 1 minute each. You could pass the mic down, and after that we'll open it up to lot 2 for the same question. Joanna, when you get that mic, we start with the minute. Thank you.
Great question. That is disappointing to hear, and we need to really work with especially the youth involved. We need to look at all the policies in place and figure out where the deficiencies exist. Why aren't our youth, the future of our city, in place? We need to look at the waiting times. We need to look at why the funding is not there. Maybe look at the region and redirect the sources of funding to those needs. We need to work with the federal government. We need to work with the provincial government, put things in place, and really put money towards these kids. First step is always going through the deficiencies, looking at the wait times, why at the 6 months to a year, and then putting policies in place that ensure that our children get the services they need.
Thank you. Dominic.
I can draw on my personal experience with one of my sons who went through this process in the South Lake. The issue there is not the services that the hospitals provide. It's the Provincial Government Act, the Mental Health Act, which is basically a revolving door. The region and the health services are I think, sufficient, but they have no enforcement, unfortunately. So the issue is not the services that the region provides through the health services, through the hospital. It's the actual enforcement of the Mental Health Act that's very weak, unfortunately. And the kids today need direction, need discipline, and need all those things to direct them, to get them through the tough times, through their teen years, I gather. And that's the biggest issue, is they have no guidelines that would restrict them to get out of the hospital within 7 days, 10 days within the Act. And the issue is just a provincial issue, really. We have to address that at the provincial level and make it tougher so our kids can get the health care that they require at the hospital level. That's my issue with that particular item. Thank you.
Thank you. Sure.
I started the Human Services Planning Coalition in 2002, and over the past number of years, we have been addressing the social services across the region. I think what we need to do is to work together with this new Vaughan Action Council and ensure that mental health, especially children's mental health, becomes a priority for all the residents of Vaughan and all service providers. We've made some significant strides, but we have so much further to go. And I believe that together, addressing an issue that has become commonplace to many young people in our community, we will succeed. So I look forward to working with you and finding a solution to a long-standing problem.
Thank you, Joyce. John?
Yeah, we obviously have to get together with the federal level of provincial health services and make sure we have the funding and the access available for these families that are clearly not getting it.
Thank you.
Yes, mental health is a very serious issue for everyone in the province, and I think it's a well-known fact that it's not receiving the attention that it deserves. There is still a stigma attached to it, and I listen to radio shows on a regular basis, and that's always a major issue. What we need to do is indeed work together. It's primarily a provincial responsibility, but what we can do as a region and as individuals is to create more awareness and work together to obtain more funds and more attention to this major issue. Thank you.
Thank you.
There's not too many families that I know that have not been touched by a mental health issue. It's a big problem and it's chronically underfunded. It also carries with it a stigma. We need to implement more education programs to reduce that stigma and network with schools to catch the issues early. We need to provide more resources for diagnosis and help. Wait times are unacceptable, and delay in treatment is devastating to families, and sometimes it compounds the problem. We need to provide more resources within our own communities, and access issues are problematic for many needing the care. I think one of the first steps that I really enjoyed being part of was with the Vaughan Social Action Committee pulled a meeting together of all of those stakeholders involved, and it was a fantastic outpouring of ideas, and these are how we get the resources that we need by getting together and talking about solutions together, obviously getting the funding as well. Thank you.
Thank you.
Thank you. Vaughan is a growing municipality, and families and children are needed in services of Vaughan. When we allocate services, we're not getting our fair share. Nowhere is the city of Vaughan getting the fair share in York Region. I would work with citizens and volunteer organizations to target most pressing needs for our children. The pooling. Remember that famous word, pooling. Where $12 million are being saved and they're going towards payment of the York Region debt. That's not right. That money should be directed towards social services. That was the intent from the beginning, and that's the way it should happen. And I will make sure and I will strive that those services, that money will be provided for services. Thank you.
Thank you. In my little brain, I've got Richard, Carrie, Mario in that order in terms of hands that I saw. So Richard, then Carrie, Mario, Robert, I'm going to come back.
It's obviously a question of resources, and we certainly need more resources for this issue. Sometimes it's just the little things. I find it disgraceful that we charge our kids, especially kids with mental health disorders, to use community centers. I want to see that kids, especially kids with mental health disorders, can use community centers free of charge. There is money to be found for that, and I'm sure there is. But on a bigger scale, if we didn't have the mismanagement, the waste that exists, that we've seen over the last 4 years, we would have substantially more resources to put to this particular issue, and other issues as well. We have seen all kinds of scandalous spending, reckless spending, that surely could have been put to use in other ways. And that's what I would prioritize. I'm going to save you money. I'm going to give you the money you need.
I agree with both Michael and Richard from the point of view that we are drastically underfunded. We don't get even close to the same amount of resources that other municipalities in Ontario get, and that needs to change. We need to pressure the provincial government so that Vaughan gets its fair share. However, having said that, we can use our resources better. The VSAC has done a great job in bringing a number of community leaders together with the school boards and the VCHC to pool resources and get resources to children where they're needed, and that's in the schools and in family homes. And I think this needs to be funded, and it needs to be continued. I also would like to emphasize that we need to reprioritize our spending as a community and put money in the hands of the people who are helping our children. Our children are the most vulnerable people in our society, and they deserve more than they're getting right now. Thank you.
Mario Ferri.
Thank you. First of all, let me clarify that the mental health of children and others fall within the regional mandate and not a city mandate. But the issue, one of the big issues, and you pointed it out, is this, that there's the perception at the provincial government that everything is okay in York Region. Everybody's rich, everybody's happy, everybody's got a home, nobody's got any problems, there's no housing issues, there's no unemployment issues. That's an issue for us. And so one of the key initiatives is to change that perception at the provincial level, and then having gone through the process of that, then we work with the regional government to ensure that it gets a higher priority so that we can address not only the issue of the mental health of youth, but all those other issues as well.
Thank you. Robert.
Thank you. First, we have to address the fact that the social services in Vaughan are underfunded, whether that be from the province or it be from the region. There are very few services for the social services in Vaughan. Most of the offices are located in the northern part of the region, not in the southern part of the region. We really have to push to have satellite offices set up in the southern part of the region so that the citizens of Vaughan can utilize these services without having to travel outside of our city to do so. Thanks.
Thank you. Mario DiNardo. We'll have to pass it all the way down. Thank you.
Yes, I think we need to engage the province to further participate in it. To further participate in this. I think we need to come up with more programs for the children, but we also need to come up with programs for the people that take care of people that have emotional issues. We can't forget all the individuals involved around dealing with somebody who is less fortunate and who's having problems.
Thank you.